Let's talk some sports medicine with our good friend Dr. Joe Congini from Akron Children's Hospital. Good morning, Dr. Joe.
Hey, Ray. How you doing?
You got the whole clan
Ready for
coming
Thanksgiving?
in?
We sure do. I think it's 49 people at our house.
That's going to be fun.
Oh, we have a fun time.
How many
really
birds?
Looking forward to it. Two.
Two?
They can do it with two big birds. Yeah. My wife's. This is like 6 weeks of planning for this day. It really is. I'm not kidding you. There's notes all over my house about how she's going to do this. It's amazing.
I think it sounds fun. All right, what do you got for us today?
Well, you know what? I want everybody to be aware of what the sport medicine team, we're just like any other team, and we have a lot of different team members. One of the newer members of the team that's really critical, and we're in the process of recruiting one right now, is the sports psychologist, the mental health expert. The reason it's a little tricky at our place at Children's is they have to be experts in psychology, they have to be experts in sports, and they have to be experts in kids. So a lot of people fill the first two bills, but they're just not used to working with kids that are 13, 14, 15, 16. But let me tell you a little bit about why we need them so badly, why they've become kind of a indisposable part of the team in the last 10 years. You might have seen an article, I think, this week in the local paper about some sports psychologists commenting on the Myles Garrett thing, but there's so many jobs they do. In sports medicine, a lot of times when our athletes are injured, they just lose their status, they drop off, we get a lot of anxiety, depression, other issues. One injury particularly is concussion. We know that about a third of kids that are concussed, if it lasts longer than 2 or 3 days, or 2 or 3 weeks of post-concussion syndrome, they have a very high incidence of depression and anxiety. So also on our orthopedic side, the post-op patients really struggle with a pretty high incidence of psychological problems. And over in rehab, our PTs can be with people when they're rehabbing an ACL or a 3-month injury or a 6-month. They can be with them that whole time. They kind of act like a psychologist for them, but with a lot of issues, we need that person on the team. So one of the big other areas is getting peak performance. So many of our athletes know these days to be at their peak performance, they need some of the psychological strategies that are used out there to do the best they can do. If you noticed in that article, they said particularly baseball, which is a very, I know you know this, mental related game. It has lagged behind in football. I think a lot of people think football's an instinctive game and not as much of the psychological aspects of positive mental imagery. How do I do better when I'm doing poorly? How do I stay on edge of being the best I can be? And the psychologists help us with that. We had a survey going called PHQ-9. It's a 10-question survey that we did on everybody who came through sports medicine last year. And oh my gosh, we were surprised what a high percentage of our athletes have psychological problems, all the way to the point of where many kids talked about even having suicide ideation and issues like that were a big deal. With those patients, we couldn't just send them home. We had to find someplace. And one of the deals that with the Kevin Loves of the world stepping out now and talking about some of the issues of the pressures on the athletes and other things is in a lot of parts of the country, they just don't have access to mental health providers. And so a lot of these people fall between the cracks. And even if they're coming out, it could be 2, 3, 4 weeks. And one of the good things about in Akron, Ohio, I think we've caught up with this phenomenon. I think we're pretty well stocked in being able to get people in when they have mental health issues related to sports. And the sports psychologist has become an indispensable part of the sports medicine team.
Wow. And so much of it has to do with performance. And then if the performance isn't there, how do you circle the wagon, circle yourself, and get back to that level?
That's right. I mean,
whether it's injury or something
and you
else.
would think for most people, they just have no reserve to know, hey, what direction do I go? They have no idea at all. And so we got the idea a little bit more working with Akron U, where all of our injured athletes have an automatic referral to our sports psychologist at the University of Akron. And it's been such a positive. Oh my gosh, back in the day, you know what this could have done to my free throw shooting percentage? I just couldn't knock one in. I remember it kept dropping. No, but so being positive and negative and being able to figure out what can I do to be at the best I can be. This is a person. Okay, we talk about nutrition being important. We talking about physical conditioning and being a very important piece of the sports medicine. Oh my gosh, the sports psychologist is critical.
What about preventative? I mean, we talk about picking up the chips if something goes wrong and such, What about before there's ever anything that goes wrong? Is there mental aspect on
No
that side
part
too?
of it, no doubt about it, and I think everybody's really catching on to this. A good friend of ours is the team sports psychologist at Ohio State football. He's from this area. All the great stars are from this area, as you know, as I feel. This great kid from Lake, Ohio, is down there. He is so closely embedded with the team. He's with them every day. He's with them at all the meetings. He has meetings for the whole team to give them hints about what they should be doing. At certain times of the year where there would be a natural lull, he's picking them back up. And so they become an embedded part of the sports medicine team. And behind the scenes, what you don't hear about, I mean, they're saying with baseball teams, there's upwards of 4 or 5 of these people embedded with professional baseball teams. And they are working on these things year round, because at different times of the year, you need different aspects of mental health to be as sharp and be on your game and to improve peak performance as much as you possibly can.
Good stuff. Thanks for coming in. Hey, Joe, one final thing.
Yeah.
Kevin Love missed the game the other night with this lingering back issue. He's had some back issues for a long time.
Sure.
I mean, where is he? Obviously you don't have x-rays and that type of thing, but with the back issues with Kevin Love, I mean, this doesn't seem like this is going away.
Well, it's just so common.
Is it the rigors of the NBA?
It's so common in the rigors of the NBA. So common. And I haven't heard of him being on the list. So the biggest thing that we need to sort out with backs when they linger like this, and it starts with kids. I see a lot of kids in junior high and high school with lingering back pain, is finding out, first of all, if they're not getting better and responding to our typical first few steps, which is maybe a little relative rest, definitely some physical therapy. They're not getting better. Getting further imaging to find out, is there something structural that we have to do something about? Structural means like, do they have a disc? Do they have a stress fracture? Could an injection help them? Are they all the way to the need of surgery? So we haven't heard of those things with Kevin Love. So I think from the standpoint of, he probably falls in the area where there's not a structural problem. More of these are then fall in a category called mechanical, muscular, a balance issue of those 200 muscles in the back and issues like that. And when he comes to those overstress times, he's going to probably need some nights off, and he's going to struggle with that. But it's so common the higher the level you go in sports.
Good stuff. Have a great Thanksgiving. Enjoy that crew tomorrow.
We will, Ray. You too. Have a great Thanksgiving.
All right. Dr. Joe Congini takes time to join us in studio on Wednesdays here on the Ray Horner Morning Show.